This program is brought to you by Sirius Texas Barbecue. We take our meat seriously.
You're watching Durango TV News. I'm Wendy Graham-Settle. September has been designated as Prostate Cancer Awareness Month to bring attention to the second most common cancer in men. But it's also one of the most treatable cancers if found early. Unfortunately, its detection and treatment remain controversial, partially because of the unreliability of screening tests and partially because of the nature of the cancer itself. Prostate cancer tumors can be slow-growing and relatively harmless, or they can be aggressive and potentially deadly. The deadly tumors are less common than the slow-moving cancers, and the typical American male has just a 3% chance of dying from prostate cancer. In 1994, the Federal Drug Administration approved the use of the prostate-specific antigen test to screen for the proteins that prostate cancers produce. The test shows only the presence of proteins and doesn't actually detect cancer, nor can it distinguish between the two kinds of cancers. Furthermore, it can lead to a false positive and more unnecessary tests.
Screening is a very controversial area for prostate cancer. We've gone from recommending all men get screened for prostate cancer after a certain age to recommending against screening for men because we weren't really able to show a benefit to the screening. Not that we couldn't diagnose the cancer, but the data wasn't there as far as the benefit.
A high number of antigens from the test often leads to a biopsy, which carries its own risks. If the biopsy shows cancer, then that can lead to treatments with a variety of risk factors or side effects that could be worse than the cancer itself, especially if it's the slow-moving kind that doesn't cause harm.
In the earlier stages, we don't have the data at this time to say which men with their cancer will be slow-growing or which men will be faster-growing or more aggressive. Now, there are some that tend to be very aggressive, but for the majority, we don't know what those populations are. Okay? So it becomes a area of discussion with the patient as to what they want to do. Some men choose to be watched and just follow their cancer until it progresses or until it worsens. But a lot of men do choose to be treated. And the main treatments are either going to be surgery to remove the cancer or radiation treatments, either doing radioactive seeds to implant the prostate or a course of external beam radiation where they come in every day for 6 to 8 weeks to have their radiation therapy.
A number of statistical studies have found no correlation between the use of the antigen test and lowered fatality rates from prostate cancer. And because it can lead to false positive results and unnecessary surgical procedures, the American Cancer Society no longer recommends routine prostate cancer screenings. However, it does recommend that men discuss the risks with their physicians to decide whether screening tests are warranted. And be sure to discuss any physical symptoms that may be present. Early prostate cancer usually causes no symptoms, but more advanced cancers may, especially at night. Contact your doctor if you have problems with urinating, including a slow or weak stream or the need to urinate more often, especially at night. If you have blood in your urine or semen, if you have erectile dysfunction, if you have pain in the hips, spine, chest, or other areas from cancer that has spread to the bones, if you have weakness or numbness in the legs or feet, or loss of bladder or bowel control from cancer pressing on the spinal cord. Although those symptoms may be caused by something other than prostate cancer, the bottom line is that you need to tell your healthcare professional about any unusual symptoms to stay on top of your health. If you'd like to know more, visit the American Cancer Society's website at cancer.org.